Hello, my name is Kevin. I am a student at Nightingale College. Today I will be administering intravenous fluids and medication. Before I begin, I am in the appropriate school attire with my badge present. I am going to, before I administer any medication, I am going to make sure that I have the right patient, right medication, right dose, right route, right time, right documentation. I am going to gather my supplies, knock on the patient's door, enter the room, introduce myself, explain the procedure I am going to perform, verify the patient using 2 identifiers, and check for any allergies. This could also be done by checking the patient's chart for further clarification. I am going to perform hand hygiene and don clean gloves. Before I administer the medication, I've already done a calculation. So for my fluids, I am giving 150 mLs of fluid over 60 minutes with a drop factor of 15. That leaves me with 37.5 drops per minute. Rounding up equals 38 drops per minute. The medication is amoxicillin 100 mLs to be given over 15 minutes with a drop factor of 15. That leaves me with 100 drops per minute. For my supplies, I have my primary tubing, the secondary tubing. I've already opened it. So with my primary tubing, I have the spike. I'm going to have the cap on just to maintain sterility until I spike it. I have the drip chamber, which is going to fill up halfway with medication, and I will be counting the drops. I have the roller clamp, and this is to be in the off position so that fluid does not flow out. I have my Y site as well as my adapter. I have my secondary tubing, same thing. I have the spike with the cap on, the drip chamber, which I will fill halfway with the medication and count the drips that flow into the chamber. I have the flow or the roller clamp that is adjustable, and then I have my adapter, which will connect to the Y site of the primary tubing. And then I have my fluid and medication. So I will begin with removing the cap for the fluid bag and the cap to the primary tubing. I will spike it. I will make sure that the roller clamp is in the off position so that fluid does not flow out of the tubing when I flip it over. So now that it is flipped, I will hang the tubing. And when hung, I am going to make sure that it is 30 inches above the IV site. This is where I will squeeze the chamber and make sure that the fluid fills about halfway. I will remove the cap to the primary tubing. And then I will slowly roll the roller to the wider side so that I can prime the tubing. Just remove any air. Okay. So once it is primed, I'm going to roll it back to the off position. And then I will be counting the drips per minute. In this case, for the fluid, it is going to be 38 drips per minute, and I will count that for 1 full minute. So I am going to slowly roll the clamp and count the drips going into the chamber, and it should be 38. Okay, so that is 38 drips. I'm going to roll the clamp back to the off position and place the cap back on. Then I will hang the excess tubing to the side. Now with my secondary tubing, same thing with the medication. I'm going to remove the cap for the secondary tubing and then the cap for the medication. I'm going to spike it, making sure that the roller is in the off position so that fluid does not flow out of the tubing once flipped. Now that I have that, I am going to I will get my alcohol pad. And I will clean the Y side so that the secondary tubing can connect to it. Okay, make sure that's connected. For my primary tubing, I'm going to make sure that it is lower. And then I will hang the medication higher than the fluid. Okay, once that's connected, I will now squeeze the chamber halfway so that fluids can fill. Okay, so that's about halfway filled. I'm going to remove the cap to the secondary tubing. And then I am going to prime it. So I will roll the roller to the wider side so that fluids can come out, so that the tube can be primed. Okay, once that's primed, I will roll it back to the off position. While I'm doing this, my fluids is, I held it, so it's in the off position. Okay, so now I am going to resume the fluids. So this is going to be 38 drips, so that's resumed. I am now going to count. This is going to be 100 drips per minute, so we're going to do that. So I'm going to slowly regulate it so that 100 drips can fill. And this will be done in a span of 1 minute. So that is 100 drips per minute. I'm going to roll the clamp back into the off position. So my fluid is at 38 drips per minute. Medication is 100 drips per minute. It is flowing. I will connect this to the patient's IV site. So once that is connected, I am going to remove my gloves, perform hand hygiene. Exit the patient's room and document that the intravenous fluids and medication administration is complete.